Okay, let's move this. Hey guys. All right, the heart, 4 chambers. Sometimes it's best just to get the basics. So we go, blood's gonna flow to the atrium, ventricle, to the lungs. Back to the lungs, atrium, ventricle, to the body. Okay, so just AV lungs, AV body. And once you get the basics, then we look at just the details, how this blood's flowing. It's going to arrive at the right atrium because this is your patient's right side. It looks maybe left to you, but it's my right. So that's the right atrium. It's going to fill up with blood that's coming from the vena cava above, which is called the superior. So it's draining the shoulder and the head. And the inferior vena cava, that's coming from the legs and the torso. So all this blood's going to kind of leak back to the atrium. Then the atrium contracts, and it's going to drive the blood through this valve right here called the right AV valve. Give you a view of it right there. Now it has 3 cusps, so we also call it the tricuspid. And it's anchored by these chordae tendineae, which look like little tendons, cartilaginous tendons. They're attached to papillary muscles there. And so the way this works is the chordae tendineae are going to pull the valve open and then let it close. Pull it open, let it close. So we don't have backflow or regurgitation of blood. So once we go past the tricuspid, we get to the right ventricle, which is kind of small, right? And look how thin that wall is. That's because we don't need much muscular power to drive the blood to the lungs because they're so close. Okay, so you know you're looking at the right side when the myocardium is thin. Then we're going to, at the contraction, ventricular contraction, we're going to pump blood through this pulmonary semilunar. And think of pulmo lungs. And the reason this is blue is because it's deoxygenated. Now the blood isn't blue, but this helps us learn. So that's deoxygenated blood. Going to go to the lungs. From the lungs, we're going back through the pulmonary veins. Now this is kind of weird because usually we think of veins carrying deoxygenated blood, but really a vein is any blood vessel that's returning to the heart. An artery is something moving away from the heart. So it's kind of the one exception in the body where we have a artery that's carrying deoxygenated blood and a vein that's carrying oxygenated blood. Kind of strange. We arrive at the left atrium, and here there's a valve with 2 cusps. So on the left AV, we're going to call that the bicuspid. So the 2 look very similar. Just think of the first one that blood goes through is called the tricuspid. So if you want to buy something, you try it before you buy it. So tricuspid, bicuspid. Now we're in this big left side. See how huge it is? Thick myocardium. This is the septum that separates the 2 ventricles. So all this power is going to drive the blood through the aortic semilunar back in there. It's like little moons. And then the blood's going to go through the aorta. But in its wisdom, the heart's going to feed itself first. And so that's why we have these coronary arteries. So on the right side is the marginal, which is a good name because it's flowing on the margin between the ventricles and the atrium. So that's the marginal. Then think of in between the ventricles. A technical way of saying in between is intermission in between. So we have the anterior interventricular coronary between the ventricles. On the left side, circumflex, think of circumference, going around. So circumflex goes around the back of the heart and joins into this big sinus, the coronary sinus. Now, of course, the blood keeps going, so once we get past this coronary area, we're going through the arch of the aorta, and here we have 3 blood vessels. One's called the brachiocephalic. Think of brachial meaning arm, cephalic meaning head. So it goes to the brain and the head. Then we have the left common carotid, goes to the brain. And the left subclavian, think of claving as a clavicle, so under the clavicle here. And then we have the descending aorta, it's going to go behind the heart and down, and bring blood to the other parts of the body. That's it. Yeah.